Hello, my name is Caitlin Morton. My learning goal for Term 2 is learning about the personal experience of patients with tracheostomies.
A tracheostomy is a common procedure where an incision is made into the trachea and a tube is inserted. It is used in critical care settings to clear bronchial secretions, bypass upper airway obstructions, or to provide mechanical ventilation for the patient with acute or chronic respiratory failure. Very few studies have been conducted about the patient's lived experience of having a tracheostomy. In 2009, a study was published in the Journal of Critical Care titled Tracheostomy in the Acute Care Setting, Patient Experience and Information Needs. This study was the first of its kind to be conducted. The aim of the study was to help inform healthcare members about the experience of patients with tracheostomies and about the kind of information patients may need while having a tracheostomy. The study interviewed 8 patients whom currently had a tracheostomy or had had a tracheostomy in the past. 4 main themes were identified. 1. Physical sensations, which has 4 sub-themes: feelings related to the tracheostomy tube, eating and drinking, suctioning, and communication. 2. Understanding. 3. Information. And 4. Experiences after removal of the tracheostomy tube.
The following is a dramatization used to demonstrate some of the experiences of the patients from the study,
and also demonstrates the themes that were identified.
The standardized patient being interviewed is John Doe, a 22-year-old male with a diagnosis of Guillain-Barré syndrome. The patient had a tracheostomy in place for 38 days, and it has since been 7 days since decannulation.
Hello, John Doe. My name is Caitlin. I am a level 2 nursing student at Mohawk McMaster. Is it okay if I ask you a few questions about your experience having a tracheostomy?
Yeah, sure, go ahead.
How did it feel having a tracheostomy tube?
It was restricting on my movement. For a couple of days, I was really scared of moving my head because there was something new stuck in my neck.
So, John, what was it like eating and drinking having the tracheostomy tube?
Swallowing was really awkward. It still actually is. I was uncomfortable with it because every time you tried to swallow, you could feel this lump there. It's so dry and you're thirsty all the time.
How did you feel about the suctioning?
I would panic because I couldn't breathe. I had no control over what was happening. And when they go down deep, it really does hurt. But it was also sort of a relief because they took all the mucus away.
How was trying to communicate?
It got very frustrating being unable to speak, especially when I wanted people to lip read what I was saying and they couldn't understand me. They did eventually put in a speaking valve. It was nice to talk rather than mouthing to everyone.
Can you tell me more about your feelings about having the tracheostomy? Were you accepting of it?
I suppose I didn't care. It was keeping me alive and that was it. I think that most people would accept that it's there for what it's there for, to keep you alive.
How did you feel about the information you were provided?
The healthcare team gave me false hope regarding the timing of removal. This was really hard for me to cope with. I really wish they just gave me the accurate information. They come and just have a few words with you and then go on their way and not have time to sit down and explain. It would have been nice to have had more information.
What do you think the best way they could provide information?
They could have provided an information sheet telling people exactly what's going to happen to them would be useful. I think this would really help reduce some of the fear.
What was it like for you since the removal of the tracheostomy tube?
I found afterward I've been getting panic attacks where I can't breathe, and I know they're only attacks. I know they only last a few seconds, but it's still frightening.
All experiences are different for each individual. Having a tracheostomy can be very distressing to patients both during and after removal. The information that's provided to the patients needs to be more comprehensive and it needs to be more individualized to each patient's needs. One of the patients who declined to consent to the study expressed their anger at not having been told anything about the tracheostomy while in hospital. Another reported that they had found a tracheostomy tube change so dramatic that they did not want to discuss their experience. Having a tracheostomy is much more physiologically and physically traumatic for patients than we are aware of. Learning about the experience of patients with tracheostomies can help improve the care given to patients with tracheostomies in the future.